Meet Edwin, a 46-year-old with a history of IV drug use who presents with chills and fatigue for over a week. He also notes joint pain and a new, unusual rash on his hands. Notice, Edwin has fever, malaise, arthralgia, petechiae, cough, dyspnea, and a new heart murmur. His labs show elevated white blood cells, ESR, and CRP, indicating a bacterial infection and inflammation. An ECG reveals a bundle branch block, a chest X-ray shows changes consistent with heart failure, and a transesophageal echocardiogram reveals vegetative growth on one of his heart valves. Interpret. Endocarditis is inflammation of the endocardium, the inner lining of the heart and heart valves. The valves are the most common site affected because turbulent blood flow across them damages the tissue, creating a surface where bacteria can attach and grow. In Edwin's case, bacteria from his IV drug use likely entered his bloodstream and settled on a heart valve, forming the growth seen on his TEE, and the resulting damaged valve produced his new murmur. Untreated dental infections are another common cause. Respond. Treatment centers on IV antibiotics for a minimum of 6 weeks, as the infection is difficult to eradicate. Clinicians closely monitor for signs of heart failure developing from valve damage, since severe cases may eventually require surgical valve repair or replacement if antibiotics alone cannot control the infection. Reflect. With prompt, prolonged antibiotic therapy, most patients see resolution of fever and infection, with valve functions stabilizing over time. Left untreated, endocarditis can progress to left-sided heart failure, pulmonary embolism, stroke, or abscess formation anywhere pieces of the vegetation travel. In summary, endocarditis is a bacterial infection of the heart's inner lining and valves. It presents with fever, fatigue, joint pain, rash, and a heart murmur. Treatment includes prolonged IV antibiotics and surgery with significant valve damage. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.